The Ministry of Health, along with its partners, commemorate World Tuberculosis Day 2024 at Farato Health Center. This year's theme is Yes, We Can End TB. According to report from the World Health Organization (WHO), TB is the second most deadly infectious disease after COVID-19. Approximately 10.6 million people around the world were diagnosed with tuberculosis, including 5.8 million men, 3.5 million women, and 1.3 million children. Tuberculosis is an infectious disease that most often affects the lungs, and it is caused by the type of bacteria. It spreads through the air when infected people cough, sneeze, or split. Representative of Regional Director of Western 2 Health Region, Moro, said their region has the second highest case of TB.
Tuberculosis interventions in the Gambia are implemented through the regions, and data shows that Western 2 Health Region bears the second highest burden of TB disease in the Gambia, with Brikama District Hospital serving as one of the busiest diagnostic and treatment centers in the country. Our region has been working closely with the program and through our leprosy and TB inspectors, together with our community health workers, intensifying case finding in the communities, diagnosing and ensuring treatment adherence to those diagnosed with TB. As we are all aware that March 24th is set aside annually to raise public awareness on TB and to reaffirm national and international commitment to TB response. The event also provides opportunity to remind ourselves about the global health threats presented by tuberculosis and to recognize the collective efforts of all countries and partners in the fight against tuberculosis.
World Health Organization representative explained the main factors that influence tuberculosis.
To know that TB has what we call influencers. We cannot forget about that HIV/AIDS. If you look on the global statistics, what the World Health Organization is saying is that 2.2 million cases of global TB cases are attributed to undernutrition. So how can we talk about controlling TB, forgetting about undernutrition? And there is a whole ministry, a whole department responsible for nutrition. So you cannot work in isolation, of the National Nutrition Program, because undernutrition alone contributes to 2.2 million of those 10.6 million cases. Now, going back to HIV, 0.89 million of those cases are due to HIV. The primary cause is HIV. Now, not only that, the global report is saying 0.373 million are due to alcohol use. So alcohol on your also reduces, because all these things will reduce your immune system. And once, that's what the TB jam likes. Once your immunity is compromised, that is it. So this is also very important, that we also don't forget about, use of alcohol. Again, tobacco that we talk about also contributes 0.7 million. 0.70 million of the TB cases are attributable to tobacco smoke. Again, the last one, according to WHO statistics, is 0.3 million is due to diabetes. So these are revealing. So you mean you cannot talk about TB and leave diabetes. So diabetes also is a risk factor for TB. So all these together, we have to look at TB holistically, and that's why the regional director's message is very clear.
Wendy Farr from Ministry of Health highlighted Gambian statistics of TB and what their ministry is doing to reduce TB cases in the Gambia.
Tuberculosis remains a pressing public health concern worldwide, and the Gambia is no exception. It is imperative that we acknowledge the gravity of this challenge and recognize the concerted efforts required to address it effectively. In 2023, the Gambia registered 2,792 TB cases. This represents a 70% coverage as compared to 64% in 2022. Additionally, 84% notified TB patients completed treatment successfully, underscoring the effectiveness of our healthcare interventions and the TB package in particular. Crucially, the Ministry of Health remains steadfast in its commitment to providing comprehensive TB services to all individuals, irrespective of nationality or socioeconomic status. Diagnosis and treatment are offered free of charge, and measures such as nutritional support and transport reform are in place to ensure equitable access to care. Furthermore, our efforts to enhance TB services through the expansion of treatment sites, the establishment of a biosafety level 3 laboratory, and the strategic deployment of gene expert machines exemplify our commitment to innovation and excellence in TB. As we commemorate World TB Day, the Ministry of Health, in collaboration with our partners, will conduct a series of activities to raise awareness about TB, HIV, engaging communities and stakeholders in our shared mission.
World Tuberculosis Day is commemorated 24th of March each year. The day is set to raise awareness about the devastating health consequences and set up effort to end the global